Hi, I'm Dr. Rachel Tate from West Palm Beach, Florida, and I am coming to you from ACR 2022 in Philly. And I have the distinct pleasure of meeting one of my Twitter friends in person, Dr. Angus Worthing. And Angus, thank you so much for being here with us today.
You're welcome. Great to meet you in real life.
Yeah, I know. It seems like we should have done this a few years ago. Well, I have a couple of questions for you, and something that we don't really talk about a lot in Room Now is kind of the legislative update and what's going on in the Hill, specifically regarding policy. Can you give us a little bit of insight on what you talked about today at ACR?
Sure, happy to. Thanks, Rachel. So the one thing you need to remember right now that's going on Capitol Hill, besides the election, which is big, is that U.S. physicians are about to be cut 4.5% in their reimbursement for seeing Medicare patients as of January 1st, if Congress doesn't act. So this is something we talked about a lot at the advocacy session today, and how luckily the House of Representatives has a bill in place to stop that cut. The Senate also needs to act, and there is one piece of must-pass legislation that will come out of Congress, hopefully before December 15th. That's continuing government funding, probably a continuing resolution to keep the government open. And we want to get the Congress to put a patch or legislation to stop that Medicare cut into that must-pass legislation. So I'm going to tell you to text the word Medicare to the number 345345. And if you text Medicare to the number 345345, you'll get nothing major is going to happen. You just get a link back by text, and it's an easy pre-written letter. You can fill out a couple of boxes about where you live and your name, and it'll send that letter to Congress for you supporting this important legislation. So I want everybody to do that ASAP.
Well, thank you. I think it's really important for us to be advocates not only for our patients, but for ourselves. And there's a lot to be said about that. And I know that you see patients in clinical practice, but that this is something you've become passionate about. Is it part of the reason that you are in DC?
So I happen to be in DC, and I also happen to love advocacy. Everybody in Washington seems to think of Congress as local news, so I'm part of that. But you're right, Rachel, we advocate for ourselves and our patients and our profession all at the same time. Other things I'll tell you that are going on Capitol Hill, bills to reform pharmacy benefit managers, PBMs, that are controlling the access to medications and the price of drugs. Step therapy and prior authorization reform. Bills are advancing. Unfortunately, even though they're advancing, they go away as soon as Congress closes up the end of this Congress. So a new Congress will be gavelled in January, and those bills will have to be reintroduced, and will hopefully push the ball further that time. But a lot going on Capitol Hill, besides the obvious, besides the elections, and we're always staying involved. And I'm really glad to be here at Room Now, because you guys have such a wide audience, and I'm happy to get the word out about advocacy to keep people involved.
Well, speaking of that, if someone does want to get involved, what should they do?
Right. So the number one easiest way to do this is to send an email that's already been written. You can edit it and talk about your stance and your own experiences through ACR's Legislative Action Center. You can literally put in a search engine, ACR Legislative Action Center. Texting the Medicare to 345345 will get you there, and you can write a letter on all of the things I just talked about and more. There's legislation to improve reimbursement for DEXA, improving the workforce shortage that's going on by getting more slots for training programs, and you can also sign up to get prompted when there's hot legislation that we need people to send in emails. It doesn't happen very frequently. You're not going to get spammed, but you'll find out if you sign up with the Legislative Action Center about that stuff.
I think this is great. Thank you so much, Angus, for your time, for your passion, for your energy, and for continuing our rheumatology traditions of making sure we're advocates. I think it's important. So, and I like to always end with what's your Twitter handle. So please follow us. My Twitter handle is @UpToTate.
And I'm @Angus Worthing.
For this and more coverage of ACR 2022 from Philly, please follow us on RoomNow.com.